So today is 3 weeks since surgery. I went to my surgeon for my first post-op appointment. I thought I was gonna be getting rid of this stinking stint. Oh, I hate it. She did unwire me. She took off like the bottom stint thingy of the little plastic thing, which is nice because that's the one that like had. So I'm glad that's gone. I still have this and she's gonna keep it in for 2 weeks. She said it's best because of like the position of my teeth and my comfort. I'm like, of course I wanted it out, but I want overall what's best for my results. So I don't really care if I have to keep it in, I will. But it's just so annoying because this thing is so stinky. Obviously I can't talk very clearly yet, and eating is more complicated because I can only open up my mouth like about a finger's worth, and then that, ouch, that stint's annoying. So when I open up just a little too much, there's like a pain in my jaw from being new or whatever, so oops. It's just kind of like a surge of pain, kind of similar to TMJ. It's not like horrible, I know I just reacted, but it's just like shocking. So at my appointment, she cut the wires to unwire me, and then I told her I have quite a bit of feeling actually, so I can't 100% feel my chin, but I can feel that it's being touched. Okay, so I do have some feeling. Right here is a little numb and here's a little numb. I can completely feel here. Actually, this is not numb, I feel it. So this whole side is like normal. Inside my mouth, I feel everything, I think. But I could tell that my stitches were a little tight here and here and up here. And so she also cut those stitches, and I don't know if she took them out as much as she just cut them so it relieved it. Maybe they also came out, I couldn't really tell. She said during the surgery, I had a ton of blood loss, so much so that apparently they almost stopped the surgery immediately. She considered just shutting it all down. She took a moment for them to lower my blood pressure so that I wasn't bleeding out so much. And she wants me to get tested for like a blood disease because she was just really concerned at how much blood loss I had. Other than the blood loss, she said everything went well. And due to the blood loss, when I came in today, she was expecting me to be a whole lot more swollen and maybe not have such a great recovery. I had actually planned to prank her, like, cause she really made a big deal before surgery, like she wanted to. My battery just died, so it's now 5:50, so it's like, I don't know, about 4 hours later. I don't know if I'm talking any about it. Oh, every time I do that. So I just got like another jolt of jaw pain because I opened up a little too much. Again, it's not like horrible, it's just like shocking, like you're not expecting the pain. Anyway, oh, I just did it again. So it's like 4 hours later. My battery's all charged and I'm ready to keep going on this video if I can remember what I was talking about. I think I was saying how I planned to prank my doctor. So she was really, before surgery, every time I would meet her, she kept telling me how this is such a big surgery and, you know, to get my expectations, like, and I was like, you know, I had thyroid cancer, I had 2 kids naturally, like I can handle pain, it's not gonna be such a big deal. And she's like, no, it's gonna be like worse than any of those. And so I did believe her based on watching other people's journeys that it is a big surgery. And so I understood her trying to make sure that I was in reality, but I thought it'd be really funny, like, you know, if you're like miserable and it was like a hard surgery, I plan to get as like dressed up, do my hair, look as good as possible, and go in and be like it was no big deal. Like, you said this was gonna be a big surgery, and it was like I didn't have any struggles. But then I really didn't totally. I mean, like the first 5 days were exactly how she described. Like, it was hard healing from everything, having all the stint stuff in your mouth and your nose is kind of clogged, and like also leaking stuff from your sinuses, like blood and whatever stuff. It's a lot, and it is really hard those first 5 days. But after those first 5 days, you're just going up, up, up. By day 10, I felt, besides like all of like the swelling and having to deal with my stint, I pretty much felt like back to normal. I didn't have the energy that I normally do, which when I would go do things, but I mowed the lawn. I was not supposed to, so sorry if my doctor hears this. But I just wanted to like get out and do something. I was careful. I didn't like fill up the grass thing. I made it light, so I wasn't going over like 5 or 10 pounds. I was, I got out and about and did things, and I was fine. So it kind of blew my big prank that I was gonna do, because I really, I think I did very well, which I'm grateful for, because I know people in my age, I'm in my 40s, we don't tend to do so well after this surgery. It kind of puts you down a little bit. But thankfully, I don't know, I did really well. Part of it was I tried to get up and move every hour or so. It didn't happen like that jaw thing. I would say the first 5 days I pretty much lived, well, the first day after surgery I was in the hospital most of the day, and then you're like sleeping because you're drugged. I did the hydrocodone, but I don't think I really needed it. But the problem was, when you start off kind of drugged and you're afraid, oh, what if it gets painful? So you just keep taking the medicine. But it got to a point where that medicine was like so disgusting, I wanted to throw it up, that I said to my husband, I would rather have the pain than to drink any more of that medicine. I'm done with it. I think I stopped the hydrocodone or whatever it's called on day 3 or 4. I totally didn't even need it. I think Tylenol and ibuprofen would have been fine. There wasn't a lot of pain, and you're getting that jaw pain. In the beginning, you're so numb. There's not really a lot of pain. It's more of like feeling like you can't breathe because of your stint and your nose. It's just you're like uncomfortable, but you're not really in pain, at least for me, because everything was so numb. Around day 5, I started feeling back in my face and inside my mouth. I could feel like the stitches were a little bit tight. Yeah, it wasn't like a ton of pain. And then but that's when I was just like, when I had one dose, and I told my husband, I am done. Like, this is so, I'm gonna throw it up. I hate this stuff. And he was a little afraid that I would have pain and I should follow doctor's orders and take it for like 10 days. But I was like, I'm over it. So, and I mean, I haven't needed it since. I did take it one day, like around day 15 or so. I started to get a sinus headache, just to take that edge off, and I kind of regretted it because it was gross. But I didn't want to get like a migraine. And then I saw my appointment today, and a recap, I guess. My doctor mentioned like she expected me to be very swollen, especially because of my blood loss, and then just from having the surgery. Even she said without the blood loss, she expected more swelling. That she said for being week 3, I looked more swelling wise like I was week 4 or 5. So she was super happy. By the way, I just iced, and then I did heat ice, because I didn't want the swelling. My friends and family think I look like normal, like this was my face, but I'm telling you, every single day my face looks different. There's swelling somewhere else, especially from like day 1, not day 1, it took a while for the swelling to really go. Cause like day 1, you don't have very much swelling really. It's like, like if you get out of surgery, there's not that much, and it just kind of gradually builds up. I think day 4 was my biggest day of swelling, and then like after day 5 it started kind of going back down. But I don't know if you can see next to my nose all these like lumps. That's because my sinuses are like severely swollen. My doctor said like not liquids, what do they call it, fluids filled up in there after the surgery, like when you tip your head or something, like the blood and everything. And so and then it kind of leaks out your nose. I just randomly will get, I haven't really had lots of blood from there though. In the beginning I did, like the first 5 days I had some blood come out my nose, but not that terrible much. And more just like liquid and like snot kind of stuff, like a yellowy stuff, very liquidy. And so anyway, to me this is where I noticed the most swelling. And then as far as like swelling, I just have like down here, and like my friend noticed on my left side. So this is the side where I had the most TMJ issues. My jaw used to lock when I was younger. Like in recent years, it would just like pop like here. And it's like, I don't know if it's scar tissue, but I've always had this like little lump right here. Not always. In the last few years, I noticed a lump. And I believe it's from like all like maybe scar tissue or something from the popping. And it's more swollen than my right side, but it's also just part of that lump right there. And then as far as like the appointment, yeah, she was really happy of how good I've been healing. She left this stint in, as I said. In 2 weeks and 1 day, I go back. We'll take out this stint. If you have any questions, if you're getting ready, if you're getting ready to do that surgery, leave me any questions below. I followed a lot of people's journeys for over a year before I decided to have the surgery, so I kind of feel very well informed. So I know that this like jaw feeling is normal. It's just as it's like finding its place or whatever, I'm going to describe it as kind of like creaky and doesn't have like the joints all well done. And so it's going to be a while where I'll have like weird pains and stuff, and then it'll get better. I know, I think I already showed you. At this point, let me see, it's been a few hours, so can I open my mouth more than the finger? Slightly. So I know like in the beginning, I'll just be able to open it like 1 finger's length. Pretty soon I'll get to 2, and months down the road, maybe 3. Well, not maybe, hopefully for sure. That's what happened at my 3-week post-op. Just as an explanation, normally it's a 2-week post-op when they would take out or unwire you, but my doctor didn't have an appointment available. I didn't think it would be such a big deal to wait another week, and it really wasn't. I know some people struggle with the liquid diet, which I thought was going to be my worst thing too, but it honestly was like for the first 2 weeks it wasn't even a big deal. I did lose 16 pounds. I ate really well, and I never felt hungry. And in another video I can share like 3 recipes that I did that I feel like always gave me that full feeling, so I wasn't feeling like I was starving. But I had a really good variety of things ready to eat that were super easy. And then those 3 recipes, and it totally got me through. Honestly, with this stint thingy, I'm gonna probably still mostly be on a liquid diet, just because I tried to eat an egg today and it was really, I had to swallow whole, and I'm not like, I have swallow issues. I can't just swallow pieces of things. I like to have well chewed. And so I'll probably do like mashed potatoes, pudding, stuff like that, and then mostly my liquids. For lunch today, I guess I just had that pudding, and then I guess for like a early dinner, I had a whole bunch of like the Fairlife, which is like extra protein, low sugar, chocolate milk. So much so it kind of made me sick because I drank so much of it. It was just so good. But yeah, and then just another little tip, at least for me with this stint, let's just say you were gonna try to sneak and do a straw a week earlier than you're supposed to, it doesn't work with the stint. You can't suck. Like, I tried so hard in different places. Like, it was so hard, and I couldn't get like the suction. So you can't even use a straw. That stinks. I know some people keep doing the syringes, but I feel you gotta at least start exercising your lips and your like mouth. So you should use a cup as much as possible. But for water, I would like to have a straw just so I can drink more water. I'm not getting enough to drink. And I thought if I used like a really big smoothie type straw, what they call it, the little kid's sippy cup, which they do allow. So I thought it was kind of like in the gray zone. Like, it's not quite a sippy cup, it's not quite a straw, and I'm not sucking hard to get like a milkshake or something where it does damage. I wasn't being like a bad patient, okay? I just wanted to easily be able to drink quickly a bunch of water. And so I tried to use that straw thing, and man, it did not work. It was really annoying. I guess that's my update for today. I will do another update after my 2-week appointment to let you know what's going on. I hope I've been informative. I might try to include some pictures, because I know when I was researching, I always wanted to see the pictures, because, you know, you're kind of afraid, like, oh, Chaucing, how's your face gonna change and everything. And so mine didn't mine didn't change the whole time. But anyway, that's all for now. I will talk to you later, and I'll see you all in my next video. Bye.